This is Mitchel Zoler from Elsevier Global Medical News. I'm in Philadelphia at the annual meeting of the American College of Chest Physicians. I'm speaking with Dr. Danai Khemasuwan, who's an internal medicine resident at Albert Einstein Medical Center in Philadelphia. Dr. Khemasuwan is reporting this morning of a study that looked at 740 patients admitted to Albert Einstein with a diagnosis of cancer, and his analysis showed that those patients, approximately 200 patients who had been treated with a statin prior to the hospitalization, had a significantly reduced risk for venous thromboembolism than the patients who had not been on statin treatment. The risk was reduced by about 2/3. And so, Dr. Khemasuwan, what was the reason for doing this analysis? What made you suspect a link, and why do you think that you're seeing this link between statin use and reduced risk for venous thromboembolism?
So, statin has been out on the market like almost 10 years, and there are a lot of studies about using statin in the cardiovascular disease patients such as the MI and the stroke. And most of the data is about the lipid-lowering effect of statin on the arterial circulation. So I think about how about the venous circulation that possible have the same possible effect because of the beside of the lipid-lowering effect of statin. There's many studies mentioned about the anti-inflammation and anti-thrombotic effect of statin. So I decided to look for a relationship between using of statin in the patient who considered to be high risk in the cancer patient with the incidence of the P and DVT.
And so, having found this significant reduction in the risk for VTE with statin use, what do you think is the next step in trying to develop this concept?
Yeah, so this is observational study. This is thought-provoking for an alert other medical societies to conduct prospective experimental studies, and then we can draw the conclusion that the statin that help to decrease the incidence of P and DVT in the cancer patient. Also, we can conduct the study in other high-risk groups such as the perioperative patient too. This is the next step. Mm-hmm.